Sudden appearance of a rash on your skin can set alarm bells ringing. But how can you tell the difference between a harmless mold and skin cancer? In this video, I'll be telling you about the ABCDE checklist that you can use to determine what is happening. Unfortunately, a number of people with darker skin complexion finds it takes longer. Research finds that it takes longer for both doctors and patients to identify this type of skin cancer. Reason for this is that skin cancer is topical. So can you imagine, on a darker skin, it is more difficult for you to detect when something else is happening there. So what should you do? You should always check your body, know when something strange or something different has appeared on your body in terms of a mold. Well, on darker skin complexion, because of the darkness, then it makes it harder to find. But it is going to be very important that you do not miss the checklist. Skin cancer, for the most part, is caused by overexposure to UV rays, which is found in the sunshine. The ABCDE checklist was developed in 1985, and I have my notes here, and it was developed by Alfred Koff, MD. Now he's a professor of dermatology of NYU.
Ding dong. Hey ya, hey ya, hey ya, hey ya, hey ya. Okay, everyone, let's do this. 3, 2, 1.
There are two types of skin cancer. You have melanoma and you have nondular melanoma. The difference is that melanoma has the tendency to spread. It is more deadly as well. It has the tendency to spread to other parts of the body if it is not caught soon enough. The danger is that it can go deep into the skin to the extent where it goes into the bloodstream, and that is where it can become fatal. Nondular melanoma, on the other hand, it mimics benign condition where it can appear as just a blister or an acne. The danger with this one as well is that it is under the skin, and what it does, it has the tendency to go down inside instead of just showing up as the skin. So you would agree that melanoma is more easy to detect. Unfortunately, both doctors and patients are finding it more difficult to detect skin cancer on people with darker skin tones. The reason for this is that, for example, with the melanoma, it is topical. It will appear as a rash, so it is easy for it to go unnoticed. So it's going to be very important for you to be checking your skin, just like how we have been told to check our breasts for any unusual lumps, etc. It is going to be very important for us to be checking our skin to see if there is any unusual moles, no sudden appearance of a mold or anything like that. So if for example you have found the appearance of what is a mold, what you're going to do is to pay attention to it, and there is what is known as an ABCDE checklist that you can use. So when you find the mold, this is what you are going to look for. The A stands for asymmetry. Most molds or most melanomas are uneven or they have irregular shape. So you're going to pay attention to it. A. B stands for you're going to look around the edges. Melanomas are irregular and jagged, so you look around the edges. If it looks a bit jagged a bit, then you need to pay even closer attention to it. C is for color. Melanomas usually have more than one colors. So for example, it can have different shades of brown mixed with black, red, pink, white, or blue tint. So look out for the changes. D is the diameter. Most melanomas tend to be more than 6 millimeters wide. When you're talking about 6 millimeters wide, if you can imagine the shape of just a pencil rubber, the eraser that's at the top of a pencil, that is 6 millimeters wide. So if you notice that the rash is more than that, you need to pay attention to it as well. E stands for look for changes in the size, the shape, and the color of the mold. If it starts changing color, then of course it is time for you to see your GP. It is time for you to see your doctor. So pay close attention. If there is a sudden rash, remember, sometimes it's a harmless rash, but other times you need to pay attention. So the suggestion is that you, for example, take a picture. If you see a rash, a sudden rash has appeared, mold, something different on your body, just take a photograph of it. And over time, probably for a week or so, you keep checking for these signs, the ABCDE checklist. If you use that checklist, then you will know if it is time for you to take action. The problem is that melanoma can become deadly in as little as 6 weeks. Because if it is left untreated, it goes into the bloodstream and a lot of things can happen there. I hope that the ABCDE checklist will make it easier for you to actually detect whether it's a harmless rash or something to be more, for you to pay closer attention to. Also pay attention, keep checking your bodies, everybody, because it is going to be there. Thank you for watching this video, my Destiny family. Until I upload another video, I'm saying peace.